Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Wednesday, October 21st, and it is 5 p.m. So, yesterday we started talking about super spreaders and where you want to sit in a room to be best protected. So, most importantly, most of this information is based on information that COVID-19 travels by aerosol. Okay, we know that droplets are still the highest risk for transmission, explaining why social distancing and masks are largely preventing infections from spreading. Okay, so understand that that still applies, but knowing that aerosolization is becoming a small component that we have to consider, being aware of some of this information is going to be helpful for you. So aerosols carry less virus particles than droplets, but may linger in the air a bit longer. So if a super spreader is around, they also have larger viral loads before symptoms are even before they're even showing any symptoms, and can upset this scenario a little bit. Okay, so again, the fact that a super spreader is in the room is the reason why this information is important, because they don't know they're a super spreader and they don't know they even have the virus. So of all the engineering controls that they looked at, ventilation is the most effective to minimize infection spread, and by this I mean air exchange rates per hour. Okay, so the air supply to a room over 1 hour equals the volume of air in the room, okay, and it gives a rate of 1 per hour. Okay, so hospitals, like hospital operating rooms, typically have rates of 15 to 25, meaning every 15 or 25 times per hour, the entire volume of air in that room is turned over, okay, changed to new. So they're adding in as much as the room should hold 15 to 25 times in the hour. So for classrooms, the current regulation require air exchange of about 6 per hour. Okay, so clearly an operating room, because of the sterility environment, you need that to be much higher. That's understood. So, but in a classroom, 6 per hour means basically every 10 minutes, the amount of air brought into the room equals the volume of the air in the room. So the air comes in, air moves out, the air gets diluted. Again, there's no physical means of taking the full volume and replacing it 100% with new, because that just doesn't happen. But it's changed over and diluted and diluted and diluted. So with social distancing and masks in classrooms, the air in spaces is cleaner than actually before the pandemic. Okay, because of this air exchange rate now, again, you're social distancing, you're wearing masks, so less viral particles or any infectious particles are getting into the room. This is all good. Now, what parts of the room should be avoided? Okay, first of all, the corners of a room will likely have a lower air exchange, so particles can linger there for longer periods of time. So for those of you, like put the kid in the corner, it's probably not a good idea if you want them to get the full benefit of air exchange. Number two, being close to an air vent could mean an airborne particle from the rest of the room could wash over you. Okay, so again, being under an air vent is probably not the best place. Again, because of that reason, that air is not circulating as quickly in that spot as opposed to further away from the vent. Now, if you've ever been in a room where, when you're sitting in a room and the air vent is blowing on you, it's usually a distance across the room. Like I'm looking at my air vent now, and when I sit and the air conditioning comes on, I'm cold. But if I stand under the vent, again, assuming that the vents are pointing out and not down, which most classrooms they are, if they're pointing out, then being under it, there's going to be much less air movement because the air is moving away from the vent as opposed to under the vent. I hope that makes sense. Okay, so a study of ventilation airflow in a restaurant in China showed about 95% of particles in the room will be removed by a properly functioning ventilation system in 30 minutes. But an infected person in the room means these particles are continuously being emitted, meaning especially if they're not wearing a mask, these particles are coming out. So even if the room gets turned over in 30 minutes, they're putting out new. Okay? But if a class is an hour long, let's just say, and the students all leave, that air exchange is constantly changing over. And as I said, if they're wearing masks, probably a little cleaner in those rooms than before the pandemic or without the mask. Now, the pace of particle removal can be increased by increasing the air exchange rate or by adding other engineering controls such as filtration units or opening windows. So if they add in HEPA filters into their system or add HEPA filters into each room or open a window, open a door, air exchange is going to move and continuously move out of that confined space. That is the concern here, is being in a confined space. Not that a classroom is safer than a hallway, but people are sitting in classrooms for 30 minutes, an hour, 2 hours, whatever it may be. The more air exchange rate, right, the filters, wearing masks, opening the doors, opening the windows means that these particles are being moved. Now, as schools, restaurants, malls, and other indoor communal spaces start accommodating more people, airflow and air exchange rates will become critical factors in the spread of the virus. Social distancing and wearing masks, again, of course, will continue to be factors. However, that assists in decreasing the spread of the virus as well as limiting the amount of time spent inside public spaces, as the risk of infection increases with exposure time. Okay, so again, sitting on an airplane for 4 hours increases your risk as opposed to being on a bus for 15 minutes. Okay, all other factors being equal, which they're not. We know airplanes are way better than buses in terms of all of these factors. Now think of a smoker in a bar. This was a good analogy that I liked. The closer you are to that person, the more you smell the smoke. But eventually, the entire room is going to fill with smoke with all the doors closed, although less concentrated, right? But the whole room is going to get full of smoke particles over time. Now, stopping the smoker from smoking would equate to having a person wear a mask, and increasing ventilation in the room will assist in clearing the particles from that room much faster. So I hope that gives you a little insight on what to be looking for in the future. If you have concerns and you're going places, I mean, you're not going to ask a restaurant, hey, what's your air exchange rate? Is it more than 5? Is it less than 10? Is it more than 20? Kind of not what they even know. But these are what these places should be. The standards should be required by the government, in my opinion, to be much higher than they may be as a standard now, to facilitate all of these things opening up and keeping us safe. So on that note, I hope you're having an awesome day, and I will see you again tomorrow for another Live in 5.